Hello, my name is Tim, and today we will be presenting our TB community project.
Hi, my name is Emily. Thank you for joining. I hope you are having a great day. We are going to start off by talking about TB and explaining what it is. Tuberculosis is a disease that most commonly affects the lungs. Symptoms will be talked about in a later slide, so I will not get into that. This disease is an airborne communicable disease, which means that it moves through the air and simply by breathing, talking, coughing, and goes from person to person that way. Tuberculosis is so important to know about, as it is the leading cause of death in infectious diseases, which is why we chose this important topic.
So there are objectives that we can implement into the community, especially those that are with limited resources. One of those objectives can be recognizing the signs and symptoms that are associated with TB infection. That will be described later on in the slide. Another one would be to ensure proper cough etiquette practices. So for TB patients, this would include donning a mask before going into a facility that treats and helps with the spread of TB infections. Also, this would include covering your mouth when coughing or sneezing. So we just teach the patients with suspected TB those proper etiquette techniques. We also want to emphasize strict adherence to the prescription of medication. So they might start feeling better, symptoms may go away, and they might think that they could stop taking their antibiotics. As we know, we wouldn't want to do that because that could foster development of drug-resistant TB. We should also follow up with their care. Screening programs that focus on high-risk patients for developing TB. So screening programs that we would want to implement would be at places like homeless shelters, correctional facilities, substance abuse treatment programs, anywhere where people are most prone to getting TB. And those are the main spots we would want to target. Again, homeless shelters, correctional facilities, and substance abuse treatment programs.
Hi, my name is Nora, and I will be discussing the prevalence of tuberculosis in the homeless community. So, more than 5% of the homeless population is reported to have tuberculosis, and this is either active or latent TB. And the people experiencing homelessness have a high occurrence of certain conditions that increase the risk of getting TB. And so these conditions that increase the risk of getting TB include substance abuse, HIV infection, and just congregating in crowded shelters or just being in close contact with one another. So the combination of all these different conditions offer a favorable environment for the spreading of TB. And also, people who are homeless often lack the resources needed for proper medical care required to make an early diagnosis of tuberculosis. And so on the right, you will see two graphs. And so graph A represents the number of TB cases in people who are homeless within the year before they were diagnosed. And so it's always starting from 1993 to 2013. And as you can see, the number of cases is gradually decreasing, which is a very good sign. And then graph B is from the CDC, and it is the percentage of all U.S. tuberculosis cases accounted for in the homeless population. And so as you can see, it kind of spiked up a little bit, but it is gradually declining as well. And from 2010, 2013, it kind of plateaued, but we'll see later on with new information how that is going to play out in the remaining years. I will talk about the symptoms, risk factors, and any preventative measures that is needed to take to prevent TB for the homeless community. So firstly, the symptoms. The symptoms of TB include coughing that lasts 3 or more weeks, coughing up blood, having chest pain or any pain with breathing or coughing, unintentional weight loss, fatigue, fever, night sweats, and chills. And moving on to the risk factors for TB. I believe I already stated this, but substance abuse, but more specifically the use of IV drugs, HIV infection, even diabetes can increase the risk of having TB. There's smoking, and just staying in close quarters or congregating closely together are all risk factors for TB. And so for preventative measures, firstly, there's just a need to stop the transmission of TB in general from one adult to another. And this is done firstly by identifying people with active TB, so having the people with symptoms test for TB, and then having them go through a proper drug treatment protocol to cure the TB. And if someone has tested positive for TB but is not partaking in any treatment or not taking their drugs, then they need to be taught proper precautions such as cough etiquette, even maybe be given a mask or respirator to help eliminate the spread of TB from one adult to another. And also the presence of TB and HIV together can increase the number of people infected. So I'll be talking about one specific health resource that's available to the homeless population in regards to TB testing. So this is a program called Tuberculosis and Communicable Disease Control, which is actually provided by the San Joaquin County Public Health Service. And this program provides services for active TB cases from 6 to 9 months or even longer if needed. And the community health outreach workers actually provide direct observational therapy to ensure medication compliance is achieved. And so the Tuberculosis Disease Control Program provides public health nurses that are trained in communicable disease investigation. They even do contact investigation. They work in foodborne outbreaks and other outbreaks that involve conjugal living institutions, such as long-term facilities, boarding care homes, or sitting county jail. And this program provides TB screening for the homeless and B1 immigrants as well. And so on the right-hand side, you'll see phone numbers listed to contact to make an appointment for TB screening. And the program is free, and there is even no documentation needed. And then so the location for this TB testing is located in Stockton at the Health Services main office. And this is the address located on the slide. And then on the left-hand side are the hours. They are open from 8 to 5 every single day, except for the weekends. And they are also closed on federal holidays as well.
Okay, now that you know about resources, we are going to identify how they benefit the community. Getting the testing for tuberculosis can decrease the spread to others. It could protect you, your family, and your friends. Knowing what someone has lets the doctors know how to treat them better. If someone gets the right treatment, then they have a better chance of recovering from tuberculosis. And then if we have more people getting the right treatment and having the right test, we could decrease the amount of deaths with tuberculosis and make it not be the leading cause of death in infectious diseases.
Okay, to reflect on the TB community project, I'd like to start off by saying what we've learned. Together, we've learned objectives that we can implement into our community, such as, noting the signs and symptoms of TB patients early on, ensuring proper cough etiquette practices, emphasizing strict adherence to prescription medicine regimen, and implementing screening programs that focus on high-risk patients for developing TB. We've also learned who's most prone to contracting TB. We've learned the prevalence of this disease. We've also learned preventative measures. And lastly, we learned what health resources are available as well as how those health resources help. So we can implement this project into people who are most prone to getting TB. These would be people in homeless shelters, correctional facilities, substance abuse treatment programs. Just pretty much anywhere where people are more prone to contracting TB. Okay, so is TB a topic for Healthy People 2020. First, I want to say what Healthy People 2020 does. They are constantly promoting healthy behaviors. They promote healthy behaviors based off of many different topics, such as physical activity, overweight, obesity, respiratory diseases, tobacco use, mental health, and responsible sexual behavior, and many more. And then under those topics are your subcategories. So if we take the topic respiratory disease, the subcategory of respiratory disease would be COPD, asthma, and TB is one of them. So yes, TB is a subcategory for one of the topics of Healthy People 2020. And their goal is to promote healthy behaviors like many of the ones that we discussed.